I became fascinated with the human body's intrinsic regulatory processes for self-healing and how professionals can help to support those systems that are designed to confront disease. So it's definitely been a learning curve for me, trying to figure out when's the best time for me to introduce physical activity. And just kind of through practice, trial and error, I've realized I found myself in a position where I didn't feel like I really belonged in any friend groups. And I felt like I was misunderstood a lot of the time by my peers. And so as a result, I started...
Hello, you beautiful people. Welcome back to the Long-Term Podcast. I'm your host, Avid Villa. Today, we have chiropractic intern, avid runner, and mental health advocate, Chloe Geraldes. We will discuss chiropractic care, fitness, and mental health. Chloe is a very inspirational individual. She seems to have been speedrunning her academic work, and it's amazing to see what she has accomplished despite kind of the mental battles that she has gone through. She's been very open about it, and I'm very proud of her. Everybody, welcome. All right, we are live here with Chloe Geraldes.
Yes, you got it.
Yeah, sweet. How's your day?
It's been pretty good. I've been here since Saturday morning. And in that time, just kind of been relaxing, enjoying time with family, spending time with the dogs, working out. It's been good.
Yeah. You have such a tight schedule in school. Hey, how does it feel coming back and just having that relief?
Yes, it's definitely an adjusting period. And it usually takes me about 2 to 3 days from like the peak of my anxiety coming down from final exams to kind of relax. And for a couple days, my body's like, why aren't you doing anything? Like, you have stuff to do. And my brain's like, wait, no, you don't.
Yeah.
So it is really refreshing. It's definitely a nice reset to have at least 2 weeks off in between each quarter of school, to just kind of reset my brain and be ready to keep pushing forward.
Yeah, that's phenomenal. Well, welcome back.
Yes, thank you.
Richard Park, and then you leave in a couple of weeks and back to school?
Yeah, I'll be heading back home on the 5th, and then I start up classes again on the 7th.
Oh, wow.
Mm-hmm.
Wow. And is it just boom, boom, boom? Is it a fast track program?
Yeah, so typically a chiropractic program is around 4 years length. However, the school I go to, it's accelerated. So that's why we just go all year round for 3 years.
Yeah, you've definitely been speedrunning everything.
Yes.
So yeah, tell me about the journey for, yeah.
Yeah, absolutely. So growing up, I was playing a variety of sports from the elite to recreational level. And just kind of through playing sports, I wanted to improve my performance and reach established goals. And that also took into account overcoming any obstacles that came my way or injuries. So particularly notable injuries that I endured was a concussion. I sprained my ankle a couple times, broke my collarbone. My two main sports that I played were hockey and soccer. I pursued soccer all the way up till grade 7, and then I retired and then continued to play hockey till right before grade 12 and just kind of fell out of love with the game. And through those sports, you require the assistance of a lot of professionals such as chiropractors, massage therapists, acupuncturists, physio. And by interacting with these professionals, I became fascinated with the human body's intrinsic regulatory processes for self-healing and how professionals can help to support those systems that are designed to confront disease or dysfunction that come our way. And when it came down to considering numerous career options that would encompass my strengths, I'd always known I wanted to go into a profession that I could make a difference in the lives of those around me, and have those who I interacted with feeling better than they did when they left the interaction. And it wasn't until I started to see my now chiropractor, who's now turned into my mentor, Dr. Dave Linford, who works at Linford Chiropractic here in Chiropractic Park. When I started seeing him, watching the way he ran his practice, interacted with his patients, that's when I set my sights on a Doctor of Chiropractic degree. I ended up applying to 3 different schools, one in Toronto, one in San Jose, and then one in Portland, Oregon, and ended up getting accepted to all 3, which was incredible. But ultimately decided on going to Portland just based on my mentor had gone there and he had nothing but amazing things to say about the program. And I just loved University of Western States, it's called. I just loved their emphasis on an evidence-based approach to chiropractic care. I think that was the main thing. I'd always loved science and research, and I wanted a program that emphasized that. And yeah, now I've been in Portland for 2 years, going on to 3 years. And I absolutely love the program, and I'm happy I chose that as my profession.
That's phenomenal. And what about chiropractor itself, though? Because you talked about kind of the patients and kind of you're attracted to the body's healing mechanism, and there's other facets like physio and even dentistry.
Yep.
And it's all kind of, even med school could be a route.
Yeah.
Out of all that, why'd you choose chiropractor? Because you're certainly more than capable, and you still are very young, so that could still be a facet that you could follow.
Yeah, no, absolutely. I think it was just, I loved chiropractics. When doing research into chiropractic care, I loved that it took a holistic approach. And so basically what that entails is we're treating the human body as a whole. So, we're not just treating, let's just treat the knee or let's just treat the arm. It's really a whole person, non-invasive approach. And that's what I really liked about it. And it's all about, tailoring the types of treatments that we want to incorporate based on, patient preference, needs, and circumstances. And I think that's what made me really fall in love with the profession. Another thing too, is I saw the profound impact that chiropractic could have in such a quick amount of time. I personally have experience now that I'm working with patients. I've seen, other chiropractors that I've shadowed. A patient can walk into the chiropractic office in extreme amounts of pain, and then following treatment with their chiropractor, they walk out feeling completely rejuvenated. That's something I've never been exposed to, never really experienced. And I think I like that chiropractic care is so immediate and it's long lasting as well, the effects.
Yeah, there's definitely so many benefits to take from this, the realignment with the bones, and you guys are trained well, and it seems to be a popular method of just instead of going the traditional route and going to just the clinic and then being prescribed all these medicines and pills. Certainly going to the chiropractor is something that I've heard a lot of great things about. Like some of my friends who have gone through many doctors and all these scans, and they couldn't find anything with their chronic pain. But then they see a chiropractor once and boom, it's solved. Wonder why that is. I've always found that. Do you guys have some sort, is it just the kind of the way the bones are positioned in those cases? Like why can't they find a connection and a solution for that? But then as soon as they go to the chiro, they just somehow feel it through.
Yeah. I think it definitely is kind of an old school view. When chiropractic was first beginning, the man who created chiropractor, he believed that, if we just give someone an adjustment, we could cure cancer, or we could cure diabetes. And that is like a complete old school view. And some people still believe in that view, and that is completely fine. Every school has their own philosophy behind it. What I really like about the school I'm going to is, like I said, taking that whole person approach. And, we're not just incorporating adjustments, we're incorporating physiotherapy modalities, so ultrasound and laser. We're incorporating rehabilitation exercises. And I think with chiro, what I really like about it is we're not just treating symptoms, we're treating the root cause of the disease. So through history collection, through physical examination, through observation, we are able to determine kind of the root cause of what's going on, and then treating around that root cause, rather than just, okay, your symptoms are gone, like now you can go. I think that might be the big difference.
Chiro is not just for bones, it's for a holistic approach. Because when
Absolutely.
people think chiro, they just think the bones and they think of those the videos where it's pleasant to listen to.
Yes.
You ever get those?
Oh yeah, they come up on my feed all the time. Yeah.
So people go up to you guys for diabetes and all these things that are internally, not like aside from bones. How do you guys find a solution for this?
Yeah. So that's the old school approach. I mean, we do treat patients with diabetes, but I mean, every province and state has their own scope of practice, which is basically the treatments they are allowed to introduce to patients. So I mean, we don't have a solution for diabetes. We don't have a solution for cancer. But
Sure.
we aren't just focusing on the back. We aren't just focusing on the spine. I mean, we treat the neck, we treat repetitive overuse injuries, we treat whiplash, we can treat the extremities. So yeah, not just focusing on the spine, but it's like a whole body approach. I mean, working in the clinic at our school now, most of my patients, I don't even adjust. A lot of them I perform, soft tissue therapy on. I have a lot of patients that come in with arthritis or hamstring strains or so with those patients, an adjustment isn't an appropriate solution. I think you really need to tailor the treatments you're introducing to the patient in front of you. I mean, for osteoarthritis, I'm not going to try to adjust the thumb. That's just not going to be a solution. It'll probably even cause them some more pain. For some people with arthritis, that is a solution, but a lot of people with severe arthritis, that's not what we're going to do. So it's more so just kind of seeing what the patient is presenting with and then kind of going forward there with a treatment plan. And the whole thing about chiro too, I like, is if the treatment plan isn't working, you can switch it around, try something new, and just keep trying to figure out, what's the best solution for the problem in front of you.
Oh, fair. Okay, that makes sense now. Yeah, going back to, like, I get what you said about you can't have a person with osteoporosis and just cracking them more would definitely just proliferate kind of the symptoms
Absolutely.
And make them feel worse. But then even with people that go into with diabetes per se, while you won't necessarily find a solution for them, you could adjust them and maybe provide exercises to strengthen the other facets of their lives. And there is no cure, right? So definitely just going in for realignment and kind of making sure that the posture is good. It's certainly a good endeavor, just having that holistic approach.
Mm-hmm.
What's kind of the most common symptom or kind of injury that you see people coming in with?
I would say probably a lot of sprained ankles I've seen quite a bit of, or strains of different muscles in the body. I would say that's pretty common, especially since the clinic I work in is in our school. I see a lot of students as well, and just kind of the younger population that's more so pronounced just because of participation in physical activity or sports. So I would probably say those are the two most common things I would see.
Well, when you're young, injury is foreign, right? And you're so used to getting injured, but then it healing rapidly. Like within the day, you're fine. If you just mess up your shoulder, it's okay the next day. If it's not dislocated, then it's fine. But certainly you have all these young people that go through their first injury and they expect it to just heal on itself. But certainly going to the chiropractor is something that you guys can help them with, which is putting the bone back in place. That's what you guys do lots?
It depends on the injury. I mean, obviously if someone comes in and it's called a subluxation basically. And so basically what it is your bones aren't properly aligned, which may result in a lack of mobility in the spine. And so in those cases, we would perform an adjustment. But for an ankle sprain, I'm not going to, adjust the sprain. It's just going to make it worse. So in the case of a sprained ankle, we would prescribe exercises, or we would do soft tissue therapy around the muscles to try and strengthen around the ankle, or we would introduce laser. Same thing with muscle strains. If someone has a hamstring strain, I'm not going to go and try to adjust their hip. That's just not a solution at the time, especially if it's an acute strain. So it kind of just depends on what the patient's presenting with. But a lot of the time, if a patient's just coming in for general maintenance treatments, so, oh, my neck's a little sore, or my back's sore, and then, after our history and physical exam, we notice, okay, we found a couple subluxations in the mid back or in the neck. Those are most often cases where we would adjust, or just in cases where we want to increase the amount of mobility in an area.
That's do you do work on yourself? Is that even possible?
It's kind of funny. When I'm stressed, I'll like adjust my own fingers or adjust my wrists. But the best part about being in a chiropractic program surrounded by chiro students is you just adjust each other. So, you'll be in class and you'll be like, oh, my neck's sore. Like, can you adjust my neck for me? And someone will be like, yeah, as long as you do my back. And you just kind of trade off. And it's not only you're getting treatment, but you're practicing on each other, trying to perfect your technique as well.
That's must be so fun.
It is, yeah.
You could just use your friends as as patients, essentially.
Yes, absolutely.
And what's kind of the biggest lesson you've learned throughout chiropractor school? Because there is something that kind of stood out where you went, whoa, that's so simple, yet it's actually so profound.
Yeah. I think the biggest lesson I've learned just being in chiropractic college is treat patients the way you would want to be treated. So making sure that if they have any concerns, anything that's bothering them, listening to them, not just, okay, I want to do this treatment, I'm going to do it on them. If they're not comfortable with it, don't perform the treatment. Or, if they do want something, considering it, letting it kind of sit with you for a second, deciding if it is an appropriate approach to the problem in mind. And then also just being compassionate too. I mean, we have a lot of patients that come into in chronic pain who, are really struggling to get through day to day. You can totally tell that they are just, not in the right headspace. And so kind of adjusting your approach to the way you communicate with them and speak with them to match their energy as well. I think that's probably been the biggest lesson I've learned.
Yeah. When you go in there, you're not just going in for realignment. And sure, that is kind of the main issue that you want to address, or whether it be about your calf or that shoulder or that chest injury, you're still interacting with another human being with all their other set of problems. You don't know if they're going through a divorce or just a lawsuit of some kind, maybe a business that hasn't been all that successful, lack of sleep, and there's all these kind of comorbidities too that come with it. Maybe that shoulder injury has been giving them insomnia. Mm-hmm. And that's in a way you guys kind of have to be therapists too, because when you ask those questions, right, like a lot of things come out.
Yes. Yeah, we do have to ask a lot of questions, especially on our first visits with a patient. So we are supposed to ask, like to everyone, saying it's a prevalent problem in our society. Like, are you currently or have you ever been in a relationship where you've been physically hurt, threatened, or made to feel afraid? So we have to address domestic violence in our office. And then if a patient does come forward and say, I have experienced this, you have to, have some sort of sources you can give them. We do have to ask about what's their living situation like, what are they eating on a regular basis? We do have to ask a lot of personal questions too, like regarding their bowel and bladder health, and if they've used recreational drugs or if they smoke tobacco. So a lot of questions that, may be uncomfortable for patients, we do have to ask. And it's sort of important to cater those questions in a way that make the patient feel comfortable and not like you're coming at them aggressively as well. Especially I've noticed two patients who might be, chronic smokers. They've smoked 10, 15 years. We are technically supposed to, offer them resources to see if they are interested in quitting or not. And so it's all about kind of tailoring your communication and making sure that the patient in front of you feels comfortable with the way you're approaching them and not like you're coming at them attacking their life choices.
Yeah. I seem to have trained you very well, Chloe.
Thank you.
Yeah, if you open up your practice, then I'm moving I'm moving chiropractors then.
Yes, that'd be great.
Yeah. That's is that what they teach you in school, to address those issues as well, not just with the way the body works, but also what they're going through at home or at work.
Yeah, a lot of it is academic, hitting the books, learning the material you're presented in class. A lot of it too is labs. So learning to adjust on each other, learning how to prescribe rehabilitation exercises. But a lot of it too, our classes, teach us how to communicate and how to promote the doctor-patient relationship, and making sure that we are creating a safe space for patients when they do come into our office, making sure that they feel comfortable with us, making sure that, a lot of the time we have to have patients, put on a gown. And so that can be uncomfortable for people as well. Just emphasis on making sure that the patient is comfortable with what you're doing, checking in on them a lot of the time, asking them if something feels painful to let you know. That's really important in the chiropractic office as well.
Yeah. Have you ran it yourself? Because it seems to be you've already been, it sounds like you're already a chiropractor, right?
I know. Yeah, it is kind of confusing. So last quarter, which was my 8th quarter, us as students were allowed to start. We have a clinic at our school. It's called the UWS Connected Whole Health Clinic.
Sure.
And so the next kind of part of our schooling is that we become chiropractic interns. And so that's when we get our white coat. And so basically, as a chiropractic intern, you're allowed to provide chiropractic treatment to patients, but you're under the supervision of a licensed chiropractor. So we don't have our own license. Technically, we couldn't practice on our own, but we're under the license of a clinician. So there's a bunch of different groups of students, and we're all assigned a main clinician who, when we perform a physical exam, we have to go to our clinician and say, this is what I found, and this is what I want to do for treatment. Is that okay? And so they have to basically look over everything and make sure that what we're doing is appropriate.
It's different studying textbooks, rather than being in the field. Because when you're presented with the first patient, it's a bit daunting.
Absolutely.
Do you remember your first patient?
I don't remember my first patient, but I remember my first day, and I was absolutely terrified.
Yeah.
I think I've really gotten good at learning how to study and prepare for tests, but nothing prepares you for your first patient. I mean, we did a lot of SP encounters, which is basically they put you in a test scenario and they have a paid actor who's there to act like they have a condition and for you to respond to that.
A paid actor, eh?
Yeah. So that's part of our program as well. We have to interact with these SPs and they'll grade us on that. And we did a lot of that before entering into the clinic. But being on your own and, in an office with your patient and you, it's a completely different scenario.
Yeah, it's really intimate, hey?
It is.
When you're there with them, it's with their issues too. It's personal, and you want to help, and they're expecting the help. And if you come out of that and you didn't find a solution, it's kind of weighs down on you.
Yes,
because
it does.
You are there and you want to help people. That's why you sought out that profession.
Yep.
Now, are there cases where you just can't help them? Because I'm sure if somebody comes in with, like you said, diabetes or cancer, right? Is that common? Do people, because I know there are people who have abandoned kind of the traditional medicine route because they don't believe in it or for whatever reason. And certainly, would you say like chiropractor is like an alternative medical route? Is that?
Yeah. Obviously we're not medical doctors. We are doctors. We're considered DCs. Yes. So I mean, if a patient comes in with diabetes, they're not coming in to be treated for their diabetes. It's just kind of an underlying health condition, and they have a greater concern that they have on their mind for the chiropractor to address. Same thing with cancer. We have a couple patients in our clinic with cancer, and so they're just coming in either for maintenance treatments or something else is bothering them at the hand.
They don't expect to be treated with chiro.
Yes.
Okay.
Yeah.
Okay.
Yeah. So we're not like, okay, you have stage 4 cancer. I think an adjustment is really gonna, solve your cancer. That's not the case at all. It's more about it's an underlying health condition, but you're coming in with a greater concern. So let's say a patient with stage 4 cancer comes in, but they're having severe back pain. We'll more so address the back pain and find a solution to kind of help them cope with that as long as they can. But it is important to know the underlying health conditions our patients have, because that can definitely alter our treatment plan, especially if patients are taking medications, which increase their risk for osteoporosis, which weakens the bones. If someone has severe osteoporosis, we can't adjust. It's a contraindication. So making sure that we are aware of what's going on in the patient's lives to make sure that we are giving them the appropriate treatments for that as well.
Oh, I've learned so much.
That's good. Yeah.
Yeah. I can clearly tell you're really passionate about this entire field. Can you explain how chiropractic care can benefit athletes and those with active lifestyles like runners like me?
Yeah, of course. Basically, I mean, me being a runner myself, there's been days where my mobility is terrible or my flexibility is awful. And so by introducing adjustments in this case is typically beneficial. So promoting that realignment of the spine and the extremities, or introducing exercises that, promote enhancing flexibility or mobility, or even just correcting biomechanical faults. I feel like a lot of people, there's a lot of faults in their gait or the way that they run. And so we are able to identify that and then tackle those issues head on as well to increase, mobility, flexibility, strength. And I feel like that all contributes to maintaining that active lifestyle. I think chiro is also important too for just preventative care. So like I said before, if someone comes into the clinic and we notice that they are having some faults with their biomechanics in their gait, but they're also having knee pain, we can be like, okay, maybe these biomechanical faults are contributing to your knee pain. Let's address it. So it is really about preventative care as well. So making sure that injuries aren't progressing to worser states. And then also, if patients do endure injuries when they are being active, I feel like chiropractic care is also important in that case. We can help patients get back to their active lifestyle that, an issue has been preventing them from pursuing.
That's what have you done when you aren't as flexible or aren't as mobile that day? Do you take that day off, or what exercises do you implement?
Typically with flexibility, we'll implement a lot of stretching exercises. So incorporating a lot of dynamic stretching before the activity, static stretching afterwards has also been important. With lack of mobility, sometimes we encourage, especially for myself, I'll just take the day off and just kind of give myself a rest day to reset. But if there is a lack of mobility, that's where we can introduce those adjustments. So let's say a patient's running, but their ankle has been kind of stiff. If we do a physical examination of the ankle and see maybe that the ankle is not sitting properly that it should be, that's when we can incorporate an adjustment, and that could increase the amount of mobility that the foot has.
When you say adjustment, that's not permanent, or it just puts it back into...
That's where like the crack comes in basically. So when that's where we introduce a high velocity, low amplitude thrust typically. And we are trained to make sure that it's in the right direction. It has the right amount of velocity and amplitude to make sure that we are increasing the mobility between two joints. And that's typically where you'll hear that popping sound as well, or the crack that everyone loves. I think an important thing to note though too is hearing that popping sound, hearing that cracking sound does not mean that the adjustment was successful. Sometimes you aren't going to hear a pop or crack, and that's okay. But patients do love to hear the pop or crack. So it's nice when you are able to get one. Yeah,
it's very satisfying.
It is,
and that's why people keep coming back to, and it just feels good. Now, why does it feel really relaxing when you are being aligned or realigned? Because I've gone to the chiro probably a total of 10 times. And my favorite isn't exactly going there to address the issue, because I just recently went to chiro for my shoulders and just from overuse. He had said, Dr. Pilling over in Core and Wellness, he had told me I've just been overusing it, the constant movement, and he put some K-tape and just told me to do all these exercises at the gym. and it did help.
Oh, that's good. Yeah.
The shoulder pain has been alleviated.
Excellent.
Yeah, the alignment is what I look forward to.
Yeah.
Do you know why it feels so good to have that holistic body, just cracking? I don't know, you guys, I was putting aside and then boom, that felt really good.
Yeah.
On my other side and my back, my front. And there seems to be like a standard kind of alignment procedure for that. Hey.
Yeah. Yeah, it kind of depends on which body region you're obviously addressing. I mean, with the ankles, we'll usually do like a standing position as the doc. With the low back, sometimes we'll put you on your side, sometimes we'll put your face down. It kind of depends on patient comfort, the way we position the patient. I think the thing about why it feels so satisfying, why it feels so good, is because basically you've been living in a state of dysfunction. So your joints have not been properly aligned. You have that lack of mobility, which has created, a loss of function between your musculoskeletal system. And so introducing that adjustment, it's putting those joints back into place, back where they used to be. And so I think that's why it's so relaxing and comforting to know that, your body's going back into alignment.
So you're telling me that most people, or at least the people that don't go to chiropractors, don't have their bones aligned properly? Because
I mean, for some people, I feel like a lot of us are walking around with at least one, subluxation, which is interesting.
What does that mean?
It's like the same thing as misalignment.
Okay.
So basically joints aren't aligned as well. We call it a subluxation in chiro. That's kind of our medical term, but for layperson terms, like misalignment is a good one too. Yeah. But I feel like the majority of people walking around the planet have at least one right now. For some people, it's super painful. They can't complete the activities they do on a daily basis because of it. And for some people, it just exists and they have, no idea until they see the chiro. So
what would you prescribe to someone who doesn't really have any serious injuries and they're average. They're not the healthiest. They're also not the unhealthiest. They're average. How can they better their lives through the implementation through chiropractor practices? What would you tell them to do?
I think a really nice thing about chiro too, if they're not the healthiest too, the best thing about chiro too is we are able to provide, nutrition and lifestyle kind of guidance as well. So guiding people on, okay, maybe let's introduce this into your diet, or maybe let's introduce this type of exercise. I think this would also be beneficial. For people too who don't necessarily have any injuries, I think chiropractic care is also good for maintenance, just kind of making sure that everything is properly aligned, making sure that all our body systems are functioning well as well. I think that would be really important for them.
You guys can give out diet advice.
Yes, yeah.
Is that like a separate course, or does that just come with the education?
We do take quite a few nutrition classes. I just took a clinical nutrition and botanicals class in school. So basically learning how to prescribe different botanicals to patients, what type of nutrition is appropriate for certain types of conditions, which is very cool. But you can also take training outside of the program as well if that's something you really want to emphasize. Obviously we don't have the same amount of training or education as a nutritionist. So our scope of practice in that field is quite limited, but we are able to be like, what's your diet like? And if it is quite poor, we can say, okay, why don't we try to, implement more fruits and vegetables, or why don't we try to incorporate more protein? I think this would be beneficial.
Well, taking that holistic approach, and that seems to, is that all chiropractor schools? They all take that holistic approach when it comes to dealing with patients?
Yeah, I think that is becoming more of a well-known thing. At first, a lot of chiros, when it was first kind of coming into the world, they just believed to only focus on the spine. And I think as chiropractor is growing as a profession, becoming more well-respected, it is growing into that more addressing, the whole person and not just one region of the person. And I think that's what I really love about it, is where, helping to a person to achieve overall wellness in their life.
Yeah, because people could come up to you guys and say they have some back pain. And while maybe you guys will find a solution for that back pain, it still keeps coming back and is recurring. But then when you don't ask the question of how's your sleep, or what kind of the sleeping position, or maybe you've been eating too much sugar or the salts, and maybe you look at that from that angle. Certainly having that balance and having the approach of, okay, this is a person with their emotional needs, and it's not only exercise or alignments that can benefit them, but it's also the hundreds of possible routes and variables that could be, of the results of this back pain or shoulder pain or insert whatever ailment or injury that they're suffering with. Kind of, how has it helped you?
Just chiropractic care?
Yeah, because I know, with the Dr. Linford, I'm assuming you got injured.
Yes.
Right? And you had to.
Oh, numerous times.
Yeah.
For me, chiropractic care has been so beneficial. I mean, with all the injuries I endured, most of them I went to go see him for, and he would prescribe me exercises or incorporate ultrasound, or he would, make me custom orthotics for my skates or my shoes if my gait was off. I think I really liked that about chiro. Was it wasn't just adjustments that's our focus. It was kind of this all-encompassing profession, which incorporated aspects from physio, and it incorporated soft tissue techniques from massage therapy. I think that's what I really loved about it, and it's just been so beneficial, especially recovering as an athlete, even with extreme muscle soreness after big competitions or events. I'd go to him and I'd feel better within 2 days. I think chiro's just been very important to my life, and it always will be. So.
Yeah, because I've gone to the clinic too, and doctors are very rushed, and they just are so easily, they want you out of their office or the room really fast. And with physio too, they just focus on kind of the muscle itself and kind of that area. And there's been some change, and there's been some, talks of wanting everybody to have that holistic approach. But kind of the soft tissue when it comes to the massage therapy side of things is, and kind of even in chiro, they have that gel too, where they use in physio. You kind of get that entirety of it all. And what would you say is the most common kind of issue that people of older age come in with?
I would probably say osteoarthritis. That's been a big issue. Just kind of getting older. Arthritis is just degeneration, right? Degeneration of the cartilage around our bones that is normally used to protect our bones. And so you start to kind of get a bone on bone, which isn't comfortable and it's painful. It creates friction. So I think that's the biggest issue. We can't solve osteoarthritis. Again, it's more about just introducing treatments that are for maintenance, making sure, the patient doesn't progress as fast or doesn't worsen completely, just kind of trying to do whatever we can to make sure to meet the patient where they are now, and making sure that, things don't progress.
Yeah. Is that considered chronic pain as well?
A lot of patients with osteoarthritis, when it gets in the later stages, that can turn into chronic pain. Yeah.
Yeah. No, I was just talking to my friend, and her mother has had to leave work and has had to see numerous doctors, and none of them have an answer for chronic pain. And definitely having it alleviated is something that they would kill for. A lot of these patients I've heard, because I have some friends who work at a chronic pain facility, and it's not something that you ever get used to. Okay? Do you deal with a lot of patients like that?
We do. And a lot of the time too, it is really sad to say, but we can't completely alleviate their pain. It's more about just kind of making sure that they don't progress. And I think that's important to emphasize about chiro too. For everyone, not everyone's going to have the same response where they go see a chiro and then right away they feel 100% better. I mean, sometimes it can take a couple treatments, it can take a couple weeks, it can take a couple months. But I think the thing about chiro too is we're just trying to make sure that, you aren't worsening and we can help you in the best possible way you can based on your circumstances.
Yeah. It's one of those things in life where you never get used to it, because I've heard many people talk about how even losing an arm, you could kind of just go back and get used to the lifestyle that you have, and just losing some passions, but having that lingering feeling of just the intense pain all the time. And some days it could be a 6 and some days it could be a 9.
Mm-hmm.
It's definitely not something that I'd wish on my worst enemy. The bones, kind of, we covered that. Do you guys do any I've had some friends who've had pec tears, and what do you guys do for that?
I guess it depends on the degree of the tear.
Like purple, like it's right
like
off,
really, really bad.
Yeah.
Definitely wouldn't adjust that. You would not adjust a pec tear. In those cases, probably more so, making sure that they're taking care of it. So making sure they're incorporating activity modifications. So if something's painful, stop doing it. Maybe, not completely immobilizing the pec, but, not using it as much, or, not putting as much weight on it, with heavy weights. Some other things too. Maybe soft tissue treatment. You could incorporate laser. I mean, there are options, but definitely wouldn't adjust a high degree pec tear.
Have you guys ever had patients come in and they think it's just a minor tear, but it's just it's all purple and it needs surgery? How do you guys go about that? Do you just go, hey, like, this is out of our scope, go get surgery? How does that?
Yeah, I think more so it's the other way around, where patients think something is more severe than it actually is, and we come in and we're like, it's actually,
it's not that bad.
It's not that bad. But in those cases, I haven't had any patients like that, thank goodness. We have been exposed to a couple different patients who come in. A lot of the time we'll take vitals on a first visit with a patient. So like temperature, pulse, blood pressure. And we've had a couple patients come in where their blood pressure is extremely high. So a normal blood pressure for the typical population is 120 over 80. We'll have patients come in with like 190 over, 100. And so in those cases, right away, you have to say, okay, your blood pressure is extremely high. This is out of our scope of practice. We're going to have to call you an ambulance, or do you have someone to drive you? Those can sometimes be, terrifying conversations to have as well. Seeing the patient's face, they're terrified. They don't know what's going on. So just making sure that you're vocalizing to the patient, we're going to get you help right away. This is concerning, but we need to get you help right away. We're going to get you help right away.
Yeah, that's terrifying. Hey, you show up there and just your blood pressure.
Yeah, we've had patients come in too with that chest pain, and they think a rib is out. It's not a rib. Like, it may be, a heart attack or, myocardial infarction. And so right away we have to tell those patients, we need to call you an ambulance, or if you have someone to drive you, we will call you one. In cases too, not just, involving the heart or cardiovascular system, if a patient comes in with a condition that's out of our scope of practice, right away we will refer that patient out. So if a patient is requiring surgery, depending on the region of the body, we will often refer out to an orthopedic surgeon. But I think that's what I like about chiro too. It's a very collaborative profession as well. If we can't address something, we won't, try to tackle it on our own. We are completely comfortable, calling for extra help and just making sure we're looking out for the patient's needs and not our own personal, agendas.
Yeah, that's fair. What do you do when a person's just discombobulated and they're just highly anxious and they think they're a bit standoffish, right? And it seems that you're putting yourself out of putting yourself in danger in that situation. What do you guys do?
Yeah. As interns, we've been encouraged if a situation with a patient is making us uncomfortable, we're supposed to go to our clinician and tell them, I'm not really feeling comfortable in this instance. If we have a patient that's just, maybe they're dealing with some personal issues, they're not in the best mood, they're a little angry that they're chiro, they're angry that they've had chronic pain for 2 years and no one has figured out what's going on. I think, again, it's just all about tailoring your communication, tailoring your approach to the patient in front of you. I mean, lots of patients I'm a very upbeat and positive person. I'll walk in the room. Hi, how are you doing? Like, are you having a good day? And some patients you walk in and you start with that approach and you can just tell right away they don't want to talk or they don't want to say too much. So just kind of lowering the energy level and meeting them where they're at.
Yeah, that's fair. Definitely, there's a lot of people that are hurting, and when they're not treated the best, they could lash out.
Yep.
And it's good to understand them and be compassionate, because you never know what's going on and in their home life or in their minds.
Yeah.
Because we live in a very complicated world, and there's a lot of people out there suffering, and maybe they just come in for a minor tear or just soreness, but then they could have decades of just doubt and insecurity. So it's definitely great to be compassionate, but at the same time, there's the safety for you guys.
Yep, absolutely.
Yeah. All right. So what do you think of the people that say that chiropractor, or am I wording that right?
You can say like chiropractic care,
right?
Or doctors of chiropractor
care is a pseudoscience.
Oh, yeah, definitely a topic of discussion I've had to deal with a lot, especially when I was first considering going into the profession. And I would tell people, and I'd be so excited about it. People would be like, but why not, go in and like become a real doctor, go to med school. And I was like, but chiros are real doctors. So definitely a topic of discussion I've had to deal a lot with throughout the years. But I feel like that belief is based, dates a lot back to the original origins of chiro, like I talked about earlier, where the founder believed, chiropractic care, adjusting the spine, cured all disease. The spine was the complete source of dysfunction. If the spine was out of alignment, then, all our body systems were out of alignment as well, weren't functioning properly. And, some chiros still believe in that, and that's okay. But the school I go to, I really like it because it emphasizes that evidence-based approach to chiro. And basically, before, considering any different treatments, before, considering different approaches to chiropractic care, approaching patients, looking at the evidence that is presented, looking at the research that's been performed, looking at, the chiros amongst you who have already been in the profession for years and seeing their approach. I think that's what I really love about chiro, and the evidence is there to support it. The scientific evidence is there. It's not just kind of word of mouth that, chiro works, and the evidence is there to back it up.
Yeah, the evidence is there, and it's also word of mouth because a lot of people see how much it's changed their lives.
Yep.
And if you got someone you trust and they're telling you that it's helped phenomenally well with their back pain or their knee pain, then it's got to be something, right?
Yeah. And I mean, it's not going to be beneficial for every single person, especially people with, severe health conditions. I mean, it definitely depends on our scope of practice. And if patients are presenting with conditions that are out of that scope, obviously we can't help them. But for most conditions, we are able to, provide the patient with some benefits, which is really exciting.
Yeah. Let's talk about fitness.
Okay. Yeah. As
an avid runner, how do you balance your fitness routine with the demands of chiropractic studies and internship?
Yeah. So it's definitely been a learning curve for me trying to figure out when's the best time for me to introduce physical activity. And just kind of through practice, trial and error, I've realized I like to incorporate most of the time I am doing running. So I'll incorporate my run before classes early in the morning, or if I have breaks throughout the day, I'll incorporate it during those breaks. And for me, scheduling is very important for my personality, being able to look at a schedule and see, okay, I have this from this time, and then this time I'm free. So then I can incorporate physical activity in that space. And it's all about being flexible too. I mean, there's going to be some weeks where I'm able to go on long runs and, do a strength training workout, more than once a week. And then there's going to be some weeks too where I can only incorporate short, high intensity workouts. It definitely depends on the workload and what's going on in my life in that week. But I do try to make sure that I am incorporating some sort of physical activity every day.
Yeah. You in your breaks, like even a 30-minute break, you just go for a 5K?
Yeah. I'll just go for like a little run around campus, come back, shower, clean off, and then I'll go to my next class. So
there's absolutely no excuses then, hey?
Yeah, no.
A lot of people will say, oh, I don't really have time.
Mm-hmm.
And then when you ask them to describe their day, like, okay, you get a break. That's something. Or what are you doing in the morning? What are you doing after work or after school? And scheduling. Do you have a set in time every single day? Do you plan it a week in advance?
Yeah. Basically, I'll just go on kind of a day-to-day thing. So every day I'll plan my schedule for the next day. And I feel like that just keeps me on task. It keeps me focused. And when you do kind of cross off things on your checklist, at least for me, it feels super accomplishing and, boosts my self-confidence a little bit to know, okay, look at all I accomplished in this one day. So that's kind of been the best method for me, making sure that physical activity is part of my everyday life.
Yeah, having to erase a task that I've completed feels so fulfilling to me.
Mm-hmm.
And because there's so many things and it all seems so daunting, but then when you take it one at a time, it's doable.
Yeah.
Day by day, it's okay. I'm going to go for a run. I'm going to study, maybe meet up with a friend, meal prep.
Yeah.
And it's all doable as long as you have a plan. And certainly that's created freedom for me. And while a lot of people go, oh, like, then that's just structuring it. That's boring. Habits make sure that you actually have more energy and more power to have in the chaos and other things in life, because these are already all in order. So then you just tackle the ones that don't have kind of unnecessary, they don't have a expectation to them. They're a bit unpredictable.
Yeah.
That's what it is. And by managing all the things that are predictable, then you can better put your time into the things that are worth having. And you see this with a lot of people that don't have a plan, is they just go based on what they feel like, and that could certainly amount to catastrophe, because you don't get much done, because the moment you don't feel like it, and you just won't do it.
Yeah, absolutely. And I feel like a lot of people, my personality, I'm very anxious. I'm very high strung. And so scheduling just works best for me. And some people kind of just fly by the seat of their pants and that works for them. And I feel like everyone's different. But for me, I've always been taught control the controllables in your life. And that's just worked very well for me. Like controlling what I'm able to control, especially having the anxiety amount that I do, that reduces the amount of tension and stress I'm feeling on a regular basis. If I have a plan in front of me and I'm watching myself accomplish this plan throughout the day.
Well, you're certainly doing something right. I mean, in our graduating year, you're speed running the entire academic route of chiropractor school.
Yeah, I know.
So you need that schedule seems to work. Eh?
Yeah.
Was that always the case throughout because I know you did 3 years at the U of A.
Yeah. So I did 3 years in the Bachelor of Science program, Bachelor of Science Kinesiology program at U of A. And then after 3 years, I had enough credits. My grades were really good. And so I was able to get early acceptance into University of Western States in Portland, Oregon. I've always been like that, especially with the, walking into university, you see this high workload in front of you. I mean, high school is one thing, but you go to university, it's a completely different beast in front of you. And I found scheduling too, especially, with final exam prep or midterm prep, that just worked really well for me, especially in times where I felt like there was too much going on. I didn't really know where to start. Scheduling has always just kind of been a really good option for me to kind of lay it all out in front of me and then see, oh, you know what? I do have time to go meet up with this friend. I didn't think I did, but I'm going to go meet up with them for a coffee, or I'm going to go to the gym for 45 minutes.
Yeah. Like an hour is so much time.
Mm-hmm.
You could get so many pages read. You can get so many reps done at the gym. And you could even go for a coffee with a friend. There is time.
Yes.
And no matter how busy you are, there's time to better your physical and mental health.
Yep. And just, giving yourself time to look after yourself. I feel like, especially, when you're in high demanding jobs or high demanding academic environments, we often think to ourselves, I don't have any time for, myself. I have to focus all my energy into what's in front of me. And what I've learned through trial and error, that's not the case at all. You do have time to look after yourself. Because if you yourself aren't doing okay mentally, physically, emotionally, you aren't going to be helpful to those around you. You aren't going to be your best self for those around you.
Yeah. Well, there's also this quote by my favorite podcaster, Chris Williamson, and he says that life isn't about expediting success. It's about avoiding the pitfalls of failure. And while you can do everything right, like let's say you did the best that you could, got a 4.0 in school, you're in honors, then you went to graduate school and did all that, and you did everything you possibly could to increase productivity, but then you don't wear your seatbelt. You know what I mean? It's there's this idea in mathematics where it's minus 0, and you can times 5 by 5, you get 25, and then times that by 4, get 100, times that by 10, you get, and so on.
Mm-hmm.
But you times anything by 0 and it's 0.
Yeah.
When you forget to take care of yourself and you neglect your body and you kind of just you're too focused on one thing and you forget that one life-changing aspect, you could be driven to catastrophe.
Absolutely. Yeah. Yeah. I witnessed it firsthand. When I first moved to Portland, I was not looking after myself. I was, fully indulging in my studies in front of me, and I stopped working out. I stopped eating completely because I was so stressed, especially living on my own for the first time. I was worried about what I was going to cook, so I just stopped cooking for myself. I stopped eating altogether, and that's just no way to live either, because you're not functioning properly. Your body's not having that fuel to continue throughout the day. You're not fueling your brain, which allows you to study and enhance your focus and mental clarity. And so that's no way to live at all.
Yeah. You can focus all your energy in this endeavor, but at the end, is it worth it? Was it worth your health in exchange for amazing grades?
Mm-hmm.
You sacrificed your mental well-being and just overall just life satisfaction. And there's this idea too where would you rather be loved by everyone and hate yourself, or be hated by everyone but love yourself?
Yeah.
And when you look in the mirror and then all you see is, okay, the grades define me, and maybe this aesthetic body, that's what defines me, and all these accolades and this knowledge. That's, if you don't love yourself, if you're kind of making that a condition as to why people should seek out your companionship, then I don't know. I think that's just you're climbing a slippery slope there.
Yeah, absolutely.
Yeah.
And you're going to run into burnout way quicker than normal too. When we first entered into the program, we met with quite a few past students, and they came and did a presentation for us on our first day. And they said, make sure that you take one day out of the week, or at least a couple hours of the week, and just dedicate them to doing something you love. Take your mind away from studying, take your mind away from academics, and just do something you love. And that will prevent burnout a lot faster. And since I started doing that, that has definitely helped a ton.
Yeah, running is freedom. I say
Yes,
that all
it
the
is.
time.
Yeah. Yeah.
Like when you subject your mind into this, I get a lot of people say they don't like running.
Oh,
like
me too. Yeah, all the time.
But I don't really like running. You know what I mean? Like
I know.
Like I like running, but I don't like running.
I totally get it.
It's kind of the feeling you get, the runner's high, the freedom of when you treat the body rigorously, the mind doesn't become disobedient.
Yeah.
when you're in kilometer 4 and you just feel like you want to stop, but then you get to 5 and 6, and now you just want to keep going, and then you kind of trough down a bit, and then you kind of get your inspiration again. Yeah. I think that reminds me of how life works.
Oh,
I mean,
absolutely.
Like with anything, like with the days, there's just, you wake up in the morning and it's just amazing. You feel great, but then 3 hours later, it's just a bit boring.
Yeah.
And then you kind of get that boost again, and that's just a part of life. And I think running encompasses that all, like, especially if you do long distance. Like I know you've ran your first marathon.
Yeah, I've done
as of recently.
Yeah, I've done 3 halves, and I just ran my first marathon last October.
Congratulations.
Thank you. Yeah. Definitely a feat for sure.
Yeah. Did you listen to music while you were running it?
I did listen to music. I was feeling really good until, in the US we have miles, not kilometers, so I might just speak in miles. Up until about mile, what would it be? I think like mile 13, or no, a little bit past the half marathon point, I was feeling really good. And then I think like the last 10 miles, I was just really struggling. My AirPods died.
Oh no.
Yeah. I was like, my calves were killing me. My hamstrings were killing me. I was basically limping. I was bawling my eyes out. All my brain kept telling me to do was quit. Thank God for my parents. They were there. And my mom ended up running the last 6 miles right beside me along the route. And she's like, keep going.
Goated. That's awesome.
Yeah. She's like, keep going. You got this. You're so close. And just having her there, it combated the voice in my head telling me to quit. Yeah. And my entire life, so my mom has always been a huge runner. She's always been kind of the driving force in my life. When it comes to just, she's always been so supportive. She's always been my number one cheerleader, my mom and my dad. But in the aspect of running, my mom was the one who got me into running. And I actually ran my first half marathon with her, which will always be a memory I'll hold close to my heart. But whenever I've struggled in my life, before I had even run a marathon, she'd always say, life is like a marathon. Some kilometers, you're going to feel great. Your body's going to feel strong. Your mind is going to feel strong. You're going to be thriving. And then there's going to be times where you think you can't take another step and you need to quit. But it's all about, taking one step at a time, or, 1 kilometer at a time, or 10 minutes at a time. And eventually you will cross that finish line. And I've definitely used that idea to motivate me throughout my life as well. When I've gone through tough times, is just, think of it as a marathon, one more step each and every day.
Yeah. With every passing day, to frame it as a marathon, there's those days where you just want to stop everything.
Yeah.
You just want to give up on the degree you're dreaming of, that you've always wanted, or that running PR, because what's the point?
Yeah.
It feels like I have 100 pounds strapped to my back, and it's just so hard. But what I've learned too is everything good and bad, they do not last forever.
Yeah.
The days where you were on top of the world and everything was just so fantastic and you were on cloud nine. It ended. Now it's just, it was normal after that. The days where you felt like nothing could get better, that joy just got sucked out of you and everything is doom and gloom. The world's going to end tomorrow. It didn't end tomorrow. And I've learned to just accept the feelings of misery and kind of to just keep going. You learn and like, oh, you could be studying for that exam.
Yeah.
And you learn more. It may feel good at the time or bad, but you're still trying.
Yeah.
It's a different battle every day.
It is.
Yeah.
And when you get through those hard times too, I feel like, I mean, even with running too, the runs where I've felt absolutely awful the entire time, I find them more rewarding than the runs where I felt absolutely amazing, because you pushed yourself, you were resilient, you kept going no matter what you were feeling. And in the end, that makes you stronger, both physically and mentally.
The days where you don't want to do the thing are the most important days.
Yes.
Because when you go on the days where it's normal, it makes it that much easier.
Yeah. Yeah. Right?
Yeah. Like when you still study when you're sick and you still get up in the morning, even though it's the last thing you wanted to do.
Yeah.
Courage is not about going on when you have strength. It's going on when you got none.
Yep. 100%.
And that's, I think, we revere the people who can withstand all that pain. You can see it on their faces, whether it be they're running a marathon and they're hitting their PR, or when they're going through a wild time in their lives, but still academically, they're still giving it their best.
Yep.
And they're doing great. And I think that's just every single human being out there, right?
Yeah.
Nobody comes out of this unscathed. No one.
No.
Like, it doesn't matter how perfect they may seem, how picture perfect their lives may be online, or how they present themselves. You don't know what's going on, but it's just having a person like your mother go with you, or just having your chiropractor classmates kind of crack each other's backs, and just having moments like right now. It's just, we can't get through this alone, and it's just talking about it and running together and kind of being human.
Yeah. Yeah. I mean, no one is perfect. No one is gonna, come out of this world having a perfect life. And so in the meantime, we just have to deal with the cards that are put in front of us the best way we can. Obviously, some days are going to be more difficult than others, but I think it's important too, when, you are down bad, you don't think you can do it on yourself. Like you said, leaning on those around you and, reaching out to people for support if you need it. And because we've all been through, our own things. So,
yeah. I've repeated this so many times, but I love it so much. We suffer more in imagination than in reality.
Yes. Yeah.
What role does fitness play in maintaining both physical and mental health, especially for someone in a high demanding profession?
Yeah, for sure. I think we're all pretty familiar with the benefits of regular physical fitness. I mean, obviously it enhances your cardiovascular health. It enhances your strength, it enhances your flexibility. And I think that just the physical aspect that fitness brings, so kind of enhancing our physical function, our structural function, I think that's really important in just preventing fatigue. And I think that ties into people who are in high demanding professions, who are dedicating long hours to their profession, making sure that, they are able to combat fatigue, and, they are able to keep pursuing this profession without getting injured. I think that's really one of the big things. Physical fitness too is also, has a big impact on our mental health. Physical fitness results in the relief of endorphins, which are, referred to as the body's, natural mood boosters. And so when we have that relief of endorphins, any stress or anxiety that we may be holding within ourselves, it tends to decrease. And that's really important too, especially when you're in a high demand profession, you're dedicating long hours to this job. at least if you can have a positive outlook while you are completing the job, that makes it a lot more tolerable throughout the day, especially on days where, you just don't want to be there. And I think another important thing about physical fitness too is it's very important for enhancing cognitive function. So physical fitness enhances our productivity. It enhances our ability to focus, which I think are also really important when you're dedicating long hours to a demanding job. Just making sure you're able to focus, you're enjoying what's happening in front of you.
Yeah. So is this your secret as to how you're getting through school? So I don't want to say easy. It's not easy.
Not
but
easy. I wish.
So well accomplished in the academics. Is this the secret? Have you been leveraging exercise then?
You know what? I grew up in a family that emphasized physical fitness. My dad was always very active. So was my mom. And I think that was just ingrained from us, ingrained in me and my brother as young children was, the importance of physical fitness in your life. I've just always loved working out. I've always found it as a way to de-stress, as a way to reset my mind. And when you have that little reset, at least for me, I'm able to go back to school, be able to look at the content I'm learning, be able to look at the workload in front of me and just kind of reset and take it all in. It's just kind of more manageable after exercise. I don't really know how to explain it, but exercise, I feel like, is just always going to be a very important part of my life.
Yeah. Without it, life would just be terrible.
Yeah.
That's certainly very blessed to have exercise exist. Can you share some of your favorite fitness strategies or exercises for staying strong and preventing injuries?
Yeah, for sure. Well, definitely running has to be number one. I do it on a daily basis. I probably should take more breaks throughout the week, but I love it so much. I just kind of I do the mileage I can with that. And so, I just feel good. I feel strong after running. I feel like my mobility's increased. What I've been trying to incorporate more is just a mix of strength training, core training, and then flexibility exercises as well, just to kind of encompass, that whole body portion of physical fitness, not just working on my endurance, but also, strength and flexibility. Yeah.
What would you say to the people that say they don't run because it's bad for the knees?
Oh, yeah.
I've heard that so many times. Advent, I join you, but it's just not good for my knees.
Yeah.
I've seen 60-year-olds, 70-year-olds complete a marathon and faster than me.
Yeah, I know. I mean, there's going to be some people who running is just not tolerable for their body, and that's completely fine. I mean, I'm not going to go lift 500 pounds of weight on my back, and it's just not going to feel good.
No, but the chances of you being that anomaly where your foot is just shaped in a way that each step is just atrocious for your knees and your legs. It's
very low likelihood.
Very low.
Yeah.
Chances are it's probably a lack of stretching.
Yep.
It's probably just the shoes. You need to get better shoes.
Yes.
And maybe you need to get more strength training to increase the muscle in that area so you don't feel absolute misery running.
Yes. No, I feel like a lot of the time, like you said, it comes down to the shoes people are wearing. A lot of people, I see them running and I'm like, how are you running in that shoe? I have these shoes. I wear Saucony Hurricanes, which have custom orthotics. I have really flat arches in my feet. And so running would be really bad for my knees if I was just wearing a regular running shoe. So it's definitely important to make sure that you are getting the footwear that you need. And like you said, strengthening the muscles, doing flexibility, that's all important. I feel like a lot of people too are just kind of scared to run, intimidated by the activity, and they would rather just not do it than try.
It's freedom. I tell that to everyone. Actually, it was just for a person that's been in kind of the fitness life for all of high school and still to this day for almost a decade now. Mm-hmm. I just found out that you had to break into shoes.
Oh, yeah.
Yeah. So when that Canadian Mental Health Association run that I did?
Yes. Yeah.
For half of that, I ran in brand new shoes.
Oh, no.
Yeah. And at the first, I thought it was okay. It's just my feet just hurt. But I realized halfway through that I think the pain that was being inflicted on me was because of my shoes.
Yeah.
And I didn't know that. Like, is that just because you have to like, break into, like, what does that even mean? Like the way the shoes are formed, or?
Yeah. So a lot of shoes just come, without any molding to your foot, or without any molding in general. And so I had to learn this through hockey too, because I had to get custom insoles in my skates. I kept getting like bone spurs on my feet, which is basically like my bone was starting to rub against my skate and it'd create friction, and it would...
Your bone?
Yeah. So my bone on the side of my foot here, it would rub against the side of my skate, and then it started to enlarge.
It sounds painful.
It was terrible. So I had to get custom orthotics for that. But basically what it is, lots of shoes are just kind of, they come to you, without any formulation around any sort of foot. And so basically breaking in the shoe is, as you take more steps on the shoe, the custom insoles start to form around your foot. And so it kind of tailors itself in this scientific way to match your foot and how it's designed, and, how it can best support you on your run or your walk. Like I said, I have really flat feet, so having custom insoles is super important for that.
You're a fan of the running room? Your shoes there?
Yes. Yeah.
Yeah. Because I know they make you walk right back and forth, and they kind of test it out.
Oh yeah. Yeah.
Kind of cool. But even in those shoes, you have to break it in as well?
I guess it kind of depends on the shoe you're getting. I've always ran with Saucony's. That's just always been my shoe. And with that, you usually have to break it in. Yeah.
This taught in chiropractic school?
No. This is just kind of trial
fun.
And error, and my mom imparting her wisdom on me. So yeah.
That's fair. But yeah, no, running is, everybody could benefit from running. I mean, we've been doing it for centuries.
Yeah.
Right? I don't know if this is like true per se. I just hear it a lot. But back in our ancestors ran for days at a time just to hunt game.
Yeah.
Right? We are designed bipedalism, right? We are able to run for weeks on end. That's how we were able to be the epitome, the apex predators, and we were able to hunt down any prey.
Mm-hmm.
But yeah, for my ultra this like 3 days ago, I met this guy who never trains, and he just signs up for ultras.
That's insane. I could
he
never.
Just doesn't train. He works construction. Really good guy. Actually, he's coming on the podcast on Sunday.
That's exciting.
Yeah. So I'm excited to ask him what his how he is able to do it.
Yeah, I've never understood that, where people are like, "Yeah, I just like show up and run like a marathon or
they don't work out. No, they don't run.
They just show up and they do it, and that's an enigma right there. I have to say.
Yeah, it's crazy. I understood it, but it's just hard for me to formulate kind of follow-up, kind of relatable.
I get it. Yeah. I'm definitely trying to work on we call it like layperson's terms in schools, so like explaining it to like
kinda
people
like
who
normies.
Like, yeah. Well, like it's
Average,
not to be like disrespectful,
muggles.
But it's basically like how to explain to people who like never seen a chiro, like don't know what chiro is, like don't know what we do. So
I have somewhat of an idea. Now I know that it's just more than bone.
Yeah.
But like I went for it for like my shoulder pain and kind of my lower back pain, and I was just more concerned about kind of the spinal cord and kind of the bone here, whatever it's called. What's this called? Like
your arm bone?
That's the humerus.
Humerus,
right?
yeah.
But the shoulder itself.
Oh, like the glenohumeral joint?
The what?
It's called the glenohumeral joint. Glenode. So we have like our how do I explain it? You have like the head of the humerus going into the glenoid fossa. Do you need want it? Sorry.
Yeah, sure.
So you have like the head of the humerus going into which is called the glenoid fossa, and that fossa is attached to your scapula or shoulder blade, as most people are familiar with. And so that forms the shoulder joint, is like humerus head in socket.
Cool. Okay.
Yeah.
That's awesome. So let's talk about mental health.
Yeah.
What personal experience has led you to become a mental health advocate, and how do you incorporate mental wellness into your daily routine?
Yeah. Oh my goodness. Long story. basically my journey to become a mental health advocate is deeply rooted in my past experiences, not only with myself, but deeply rooted in personal experiences too, with my own father and my own grandma, who suffered from depression for years. My father still suffers. My grandma sadly passed away years ago.
I'm so sorry to hear.
Yeah, no, that's okay. Growing up, I quickly realized I was a perfectionist, and I often found myself feeling this intense amount of pressure to reach these goals that I had established for myself or reach these standards. And so my mom often speaks of this story where when I was younger, I'd be coloring in a coloring book, and if I went out of the lines of the coloring book slightly, I'd crumple up the piece of paper and throw it away and start again.
Wow.
Yeah.
So even at a young age, how old were you?
Oh my gosh, maybe 4 or 5.
4.
Yeah, very young. So right away, I would just crumple it up, even if I went on the line just a little bit, and start again. So I've always been this perfectionist, always wanted things to be perfect. And I think that's definitely where my anxiety stems from. And throughout the years, my anxiety has only progressed. Moving into high school, I feel like that was really the peak of my anxiety. I found myself in a position where I didn't feel like I really belonged in any friend groups. And I felt like I was misunderstood a lot of the time by my peers. And so as a result, I started to feel like myself, I wasn't good enough to be a part of any group. And I started to really be down on myself. And that's where I really started to experience social anxiety. And that's where I kind of first noticed symptoms of depression as well. Eventually, I really started to kind of figure out what was going on with my anxiety, where it stemmed from. When I started seeing a therapist end of grade 11, beginning of grade 12, and that's where I was diagnosed with generalized anxiety disorder. And I think there's a misconception, everyone has anxiety, like there's no disorder for it. But of course, everyone experiences a little bit of anxiety throughout their life, especially, when we're completing tasks or trying to accomplish something, or, worrying about someone we truly care about. But in the instance of generalized anxiety disorder, what it is, it's basically when people are living with an intense amount of anxiety constantly, even in situations where, normally people aren't that anxious. So this could be associated with work. It could be associated with school. It could be associated with relationships. For me, sometimes it's even going to the movie theater. I have an intense amount of anxiety leading up to going to the movie theater. My brain is constantly going, okay, you need to get to the theater early so you get to your seats. Okay, but you need to make sure you have enough time to get your popcorn and your candy. Okay, but wait, how am I going to get to, that's my brain. It's just constantly going. And so to have that diagnosis, it really put a lot of things into perspective. It really highlighted a lot of things and, made things make sense. And so that's where I figured out my anxiety stemmed. And then, moving into university outside of high school, my anxiety really peaked again. I felt like I was walking into this situation where, high school is one thing, you get to university, it's an entirely different workload. And so because of the intense amount of anxiety I was feeling, because of the, depressive symptoms I was experiencing, I almost dropped out within 3 weeks of being into undergrad. But due to the support of my family and my friends, I was able to kind of pull myself out of it and just kind of keep moving forward. And that's when I really figured out too, I needed to establish some sort of support system on campus. And that's when I got involved with the Canadian Mental Health Association student group, which was super beneficial for me. It was not only support for what I was going through, but I was able to support those around me who were going through the same thing. And I think that was a really beneficial experience and really put a lot of things into perspective for me. And so I continued therapy. I tried hypnotherapy at the time too. I tried medication as well. I've also tried, journaling and gratitude exercises. And so for a while, it was really good. It was manageable. And then when I went to Portland, I kind of fell back into that state of intense anxiety. Depressive symptoms got really bad, worst they've ever been. And I think it's because I moved away when I was 20 years old, into a country I knew no one. I was living on my own for the first time. I didn't really know what I was doing. I didn't know who I was internally. And, that caused me a lot of anxiety, caused me to really continue on that process of questioning who I was. Was I worth it? And there were a lot of days where those around me were worried if I was going to even come out of it, unscathed, where I was going to, wake up the next morning, whether they were going to hear from me, whether they were going to ever see me again. And when it got really bad in my darkest moments, I really decided I need to take charge and find a permanent solution. I couldn't keep going with temporary solutions. And so that's when I really decided to stick to my routine, making sure that I was doing therapy at least a couple times a week, making sure that I was continuing my gratitude journaling, making sure that I was continuing to just take little breaks throughout the day to check in with myself and make sure I was doing okay. And that's kind of just been my journey with mental health. It's something I still struggle with to this day. And it's probably something I will always have to struggle with, but I'm just trying to make sure I get to the point where I'm able to function on a day-to-day basis and not just function, but enjoy the life I'm living.
That's incredible. I mean, you have accomplished a great deal in such a short amount of time. And amidst this, you're going through generalized anxiety disorder, and getting up in the morning was difficult at times.
Mm-hmm.
How did you manage to still keep up with your studies? Because I know when I get into my doom and gloom thoughts, and certainly I have never sought out treatments, and I've never been officially diagnosed, but I have thought some pretty dark thoughts, and my self-worth has definitely gone down with just pressing thoughts of kind of my existence and who I am, and I relate to not knowing who we are truly.
Yeah.
How did you still get up in the morning and do the work despite having 1,000 pounds or the world on your back?
Yeah. Sometimes I look back and I don't even know how I did it. But frankly, I think a lot of the time whenever I was down bad and I was questioning, whether or not I could do it anymore, I just kept leaning on my support system back home. And even though they were far away, my parents were there for me 24/7. If I needed anything, family that lived in different areas of, Canada, I have some family in San Diego. They would fly me back home if I needed to. They'd stay on the phone with me all day if I needed to. They would send me things that thought would make me feel better. And I think just having people around me to remind me of why I was here, I think that was really my driving force. And then two, it might sound a little crazy, but I think just having the goal of Chiro in front of me, this was something I'd always wanted to do. I've still had this dream since I was 13 years old. So I'm going on 10 years of holding this dream close to my heart. And I think just continuing to remind myself of why I am in this position. It is very difficult to move away from home and be on your own. It's very difficult to even do that with mental health issues. But I think the most important thing too, I just kept reminding myself that I would not let my mental health issues limit me in what I wanted to accomplish in this world. And I think I still do that too. And that's really the message I, want to present to other people as well, is mental health issues should not stop you from achieving, your established goals and dreams. And just, lean on people for support. There's going to be days where, you don't think you can do it anymore. But the important thing is to remind yourself that you are here for a reason, and there are people out there that love you and care about you.
They're the family and friends that are there for us. And when we disconnect from reality and we get farther and farther from it, that phone call to a friend, the family member, the shared meal is what it takes to get us back into the fabric of reality. Because the farther we get away from there, that's why isolation is terrible for people. And it even shows that it's worse than drugs and alcohol to a certain extent.
Yeah.
We can't get through life alone.
No.
And I always, when I'm feeling down, I remember how fortunate, how blessed I am to be able to feel the feelings as they come, to feel sadness and to feel euphoria at times when I accomplish big feats of strength and courage, or just the ability to connect with people and to be able to be there for someone. I think it's a true blessing. And I picture a life where my parents didn't exist, because every step of the way, they were always there, right? And even some friends, and while some of them maybe were not as close as much, they were there. Or maybe even the people that hurt me, they taught me something. And I have my little brother, he's 6, and we were at Galaxy Land for his birthday this year, and just to see him succeed with the encouragement of us going, hey, you can do it. Like it's very simple, and it's very, very wholesome. But I imagine, what if we weren't there to say you can do it? What if there was no one there? And he's one of the smartest kids I've ever talked to, and very capable individual. But then, yeah, what if they weren't there? Hey, like, what if the family that you wanted to lead on weren't there?
Yeah.
We need each other. That's how we'll get through the chaos of everyday life. Because tomorrow's not a guarantee.
No, absolutely not. No.
Yeah. And it's great to have these safety nets in place, because we are not our accomplishments. And while sure, you want to keep moving that goalpost, because it is fulfilling a bit, and certainly that may be the roots of our self-worth problems too. Yeah. It's certainly a driving force to us to keep going, but that's not us, that is not who we are. No. Does that make sense?
Absolutely. Yeah, I totally resonate with that. I feel like the longest time I thought of myself and my worth as being associated with my accomplishments and getting a 4.0 GPA or being on the dean's list. And that's not the case at all. Our self-worth is, how we treat other people. I feel like that is the biggest determinant of our not our self-worth, but, our character, and is how you interact with other people in this world. It doesn't, matter about the materialistic things, but who you are as a human being inside.
How you treat others, how you present yourself to your mother, to your father. If you return from home, how do people interact with you? Yeah. Behind your back, are they saying you're vile and corrupt, or are they saying you're bubbly and compassionate and authentic? And how is generalized anxiety disorder for you? Do you feel it's in your chest? Like, did it manifest in you stuttering in front of people? How did that go about?
Yeah. I mean, everyone has different kind of associated symptoms with it. I mean, some people you'd never be able to tell. For me, the most common thing is my brain is always talking to me. You know how everyone has that little inner voice in them that tells, I don't know, I talk to myself. That's just me. But I always have like this little voice in my head that's always kind of speaking up and chiming in. Physical symptoms wise, I'll get, pain in my chest. I'll get shortness of breath. I'll go through feelings of like relentlessness, or fatigue is often associated for me as well. And that's my body basically trying to tell me that I'm in fight or flight mode, and I need to slow down and just take a minute and tell myself everything's okay. And just remind myself, I'm not in any danger. Yeah.
And that you're okay.
Yeah. Yeah. I have to tell myself that all the time, because your body wants to tell you are unsafe. You should be scared. You should be nervous. And then, your brain is telling you one thing, your body's telling you another. And it's kind of a constant fight between the two.
Yeah. And being able to triumph in that battle with every single time it comes up. Yeah. It's relentless. It's ongoing, and some days are difficult and some days are easy, but it's recognizing that you have gone through worse, and maybe that is the worst. Yeah. But after that, it's that talk we had with running and kind of fitness. the next day it'll be easier.
Exactly. I know. And my anxiety is often attributed to things I shouldn't be anxious about.
Yeah.
I mean, with like final exams, like everyone experiences a lot of anxiety, but mine's heightened by like times 100. It's crazy. But like I talked about the movie example, like why am I stressed to go do something that's fun and I chose to do and enjoyable? Like that's just the way my body works. So
Is it because you create a narrative on what could go wrong?
I think so. Yeah, my body is like pre-preparing itself for like the worst possible circumstances.
For me, for instance, I seem to think that a lot of the things that are valuable to me will come to an end because that's just everything,
Yeah,
right? Everything
yeah.
comes to an end, and I'll create this narrative in my head where, okay, you're gonna stop podcasting, or oh, you're gonna stop going to school, you're gonna get an injury that's debilitating forever, you're gonna stop doing this. And certainly I don't get social anxiety per se, and I don't think it manifests physically, but I do ruminate on it, and
Yeah.
it doesn't bode well for feeling good.
No, absolutely
No,
not.
like when you tell someone that you're ruminating in something, or it's not a good feeling.
No.
It's not, especially when it's, it's destructive.
Yep.
It's not beneficial. It's not even, you're not building anything.
No.
You're just going, oh, what if?
Yep.
Should have, could have, would have. Oh, this could happen. It's very futile.
It is. Yeah. I mean, another example for me too is I'll write a test, and until I get my test mark back, my body will convince myself that I failed the test. So for days on end, I will be stressed about this one test. And that's no help. Like I'm basically punishing myself before even getting the test mark. And that's no way to live.
Maybe this is why you were able to succeed. Hey, wouldn't you say?
Maybe, but it's definitely not a healthy way to live. It's not going to be sustainable for me. I know that. And so that's why I'm trying to take those steps to make sure, I am having it at a manageable level.
That's fair. Yeah, but you're almost done now. So
I know.
Is that still a problem?
I think I'm getting better. I would say better. I'm not like 100%. But I am getting better at kind of, pausing for a second and being like, okay, you're not going to know the outcome till you actually have the physical test mark. So why are you going to punish yourself while you're waiting for the test mark? And then the test mark comes back and it's completely fine. I'm like, why? And I worried all that time.
Not the end of the world.
Yeah.
And even if you did, you just do it again.
Yeah. It's one test. That's what I had to, learn. It's one test. It doesn't define who you are as a person. It doesn't define who you are as a student. Doesn't define who you're going to be as a professional. So
failure is not final. It is formative.
Yes, exactly. Yeah.
How do you believe fitness and chiropractic care can positively impact mental health?
Yeah. Well, just kind of jotting back to physical fitness. So like I talked about, regular physical fitness helps to boost our mood due to the release of endorphins, so our body's natural chemicals. And with the release of endorphins, we are reducing our stress and anxiety, which are some incredible benefits, especially with running. I just get this, like we talked about, that runner's high after you go for a run. And I think that is completely tied in with endorphins, right?
Yeah.
So having that release of any stress, anxiety, tension you're holding on to with physical fitness. And then I think chiropractic care definitely, encompasses that component as well, where, addressing the root cause of a patient's pain, we're helping to improve their function and, minimize or eliminate any reoccurrences of pain. And so with that, we're essentially helping to improve people's outlook on life and overall wellness. Because lots of people who are living in chronic pain, their mental health is, not strong. They're living with a lot of stress and anxiety over their condition. And I feel like being able to provide treatments that are going to be alleviating to that pain and, allowing individuals to get back to the activities they love. I mean, I've seen a lot of grandparents come in, not being able to play with their grandchildren, and that's really daunting on them as well. So being able to get back getting people back into the activities they love. I feel like that is all really tied into improving mental health and improving overall wellness as well.
Yeah. You realize some of the most important things in life are simple.
Yeah.
You mentioned that a grandparent just wanted to play with their kids.
Yes.
Right? That's just, play with their kids. It's so simple. You don't need to study for that. You don't need to train for that.
No.
But it's something that chronic pain patients just would die for.
Yeah.
To be able to pick up a box or help carry groceries, to be of value into this world. And anything can disappear in an instant.
Yeah, right.
And then certainly I just had this this guy come in, episode 89. His name's Nathan Graham, and he was born with one arm, and he has done a lot of work with people that have recently had a limb amputated, and he's been able to cope with it because he's born with it, and he's very mentally resilient, and he's gone through all the trials and tribulations of having one arm and still progressing and still being hopeful and resilient despite it all. But he's told me that, like, he has to do everything differently compared to a person with both their arms.
Yeah.
Like even opening a bread, and he mentioned this the scene in Soul Surfer. You know that
yes,
Bethany, I forget her name. Bethany something. But there's a scene where she's opening a plastic of bread, and he was laughing in the in the theater, and then everybody kind of looked at him because everybody was like,
going on?
It's supposed to be a sad scene, but kind of just highlighted kind of the simplicity.
Yeah.
And just turn up the volume on the difficulty. But yeah, it's great to remind ourselves of the beauty of every day.
Yeah, right. And I think working with patients too, I mean, like I talked about, we're not just treating the symptoms, but as chiropractors or anyone in the medical profession, you form that personal connection with your patient. And so you are essentially joining them and supporting them throughout their health journey as a whole. And it's really all about supporting, the tiny successes in their life. I mean, whether, like I talked about, whether it's a grandparent being able to play with their grandchildren, or, someone being able to tie their shoes. They haven't been able to bend down and tie their shoes due to pain. I think that's what's been truly fulfilling about the profession for me as well. Just being able to see the profound impact that treatment can have on patients' lives, whether it's, for small things for them, big things, whatever it is.
Yeah. And that must be so fulfilling, hey? Having gone with a person that wasn't able to tie their shoes or can't play with their grandchildren, can't pick up a box, can't carry their groceries inside, can't do these whole set of things. But then after however many weeks, they've been putting in the work and you've been there for them. They come back and they have found a solution.
Yeah.
Their pain is not there anymore and they can go back to normal life.
Yeah.
And in turn, that helps you instill gratitude in the everyday activities that you're doing, such as running, such as being able to go out with a friend and being able to spend time with your family. Because we get so used to the normalcy of life.
Yeah.
What advice do you have for others who are trying to prioritize their mental health while managing busy schedules or facing stressful situations?
Yeah. I think my number one piece of advice, just tying back to the importance of establishing a set routine and schedule for yourself every day. That'll allow you to stay on track. And even if you aren't able to schedule an hour out of your day to do something you love, whether it's, reading or physical activity, making sure, especially if you're in a, demanding profession or if you have a busy life schedule, just taking micro breaks throughout the day to check in with yourself, see how you're doing, and if you need anything from yourself. So whether it's, doing a meditation, or whether you need a couple minutes to, eat some food, or just doing something for yourself. I think another important thing too, I try to emphasize, is setting realistic goals and boundaries for myself. And so some days there's going to be times where I just don't feel like I have the energy to give to an activity, or, I don't feel like I have the time or whatnot. I mean, we always have the time, but I'm just feeling a little bit overwhelmed in my life. It's okay to say no to other people. I think I really struggled with that for a long time. I didn't want to let people down. And so I would often just say yes to everything. And that ended up being super exhausting for myself. So it is okay to say no to people. It is okay to just take time for yourself and focus on yourself. Another important thing too is just establishing a support system and leaning on them when you can't do things on your own. If you are needing that extra support, reaching out to people who you feel comfortable sharing your thoughts and feelings with, and knowing that, they're going to support you in the ways that you need. I feel like everyone needs a different approach to, having people support them. So some people like tough love. I'm not so much tough love. I'm more people asking me if I need anything. Am I okay? What can they do? That's been a really big thing for me. And I think the last thing too, which is especially important to me, is just incorporating a little bit of physical activity into your everyday life, whether it's going for a walk, whether it's doing a little bit of stretching, because of that, instant relief of endorphins, which promote better moods, relieve our stress. I think that's really important as well.
Yeah. There's different modalities as to how people want to be treated.
Mm-hmm.
You had said that some people, they like the harshness of grow up, do this thing, get it done. Doesn't matter how you're feeling.
Mm-hmm.
And they revel in that.
Yeah.
But there are some where, okay, you need to take them step by step. No name calling, because that certainly just doesn't motivate them. But then there's some who, in certain situations, maybe they do need that mental resilience and kind of the little smack of, okay, wake up, buddy. It's time to keep going.
Yeah.
And mixed in with, hey, we love you. Keep on going. And certainly you just need to be able to spend some time with a person, and you're able to understand them and how they work based on kind of their interests and who they gravitate towards, what they find inspirational, what they don't find inspirational, what they like, what they don't like, and taking that into account. You'll never know fully. You could kind of gauge.
Yeah.
But you'll have somewhat of an idea. You could deploy that idea if you're a true friend, if you actually care about their well-being when they do need you. And they will. Because the time comes for all of us.
Yeah.
When the barbarians are at the gates and they're knocking on the door.
Yeah.
And they're looking for who's in charge. Who's going to come to your defense when your defenses aren't well equipped, aren't sharpened, and the foundation isn't strong enough to withstand the attack.
Absolutely.
But yeah, that's definitely your journey has been like, if you weren't open to your story about having anxiety and just having these thoughts of doom and gloom, and you had shared that the next day may not have been another day, I would have thought, oh, Chloe, master's student, like expedited success. There's nothing wrong ever. Like, she's gone to run 3 halves and a marathon recently. She's living her best life. But then now you're here, and it's very brave of you to actually share that you actually don't know. You know, people could say the same thing about me. Like, Yeah.
I mean, people tend to look at our lives, especially on Instagram or just from an outside perspective, and think, I mean, they have it all, right? Like,
Yeah.
they got to be a happy person. They got to be confident. That's not the case at all. Throughout the years, I've struggled basically my whole life, and I've just become very good at masking and presenting the image of myself as like this happy person who's bubbly. She can be quiet at times, but most of the time she's very outgoing and kind. As kind of a way to hide what's going on the inside. Because for the longest time, I didn't want people to think of me as weak. I didn't want people to feel pity for me. But sometimes we have to just take down the mask, take down the walls, and trust that everything's going to be okay. And those people around you who care about you, those people who understand what you're going through, they're going to, respect what you're doing, and they're going to support you in the best ways that they can.
Yeah. You never truly know. And there's no shame in asking for help.
Absolutely not. No.
Like, the toughest of soldiers need the companionship when it doesn't go their way.
Mm-hmm.
And even kind of, I had listened to, do you know Chris Bumstead?
Sounds familiar.
He's kind of the Giga Chad of like bodybuilding.
Okay.
He's kind of the, if you think of like alpha male kind of mentality,
Mhm.
he's the winning Mr. Olympia guy.
Okay.
And like all the guys aspire to be like him. But he talks about his one of his competitions prior to it, and he was on the bathroom floor sobbing, admitting to it, and his girlfriend having to console him because he didn't feel like he was good enough, that he
Mhm.
thought he was a fake, and he didn't think he was going to amount to anything, despite having this phenomenal body, which he has given so much work. Like, you look at that person, and he's just so honest and humble, and still being able to show up on that stage, give it his all, but still it's not going to be 100%.
Yeah. Yeah,
Yeah.
absolutely. No, I totally get that. I feel like, yeah, like I said, I mean, a lot of people can look at your accomplishments and look at you, who you present on Instagram, and think, why would they be depressed? Why would they have anxiety? So you never really know what people
Yeah.
are going through. And I feel like the best approach is to just treat everyone with kindness and treat people the way you would want to be treated. And if people, do confide in you, checking in on them, making sure that they're doing okay, asking them if they need anything to reach out, and just, trying to be a good person. I feel like that's really important.
Yeah. It's like that millionaire that's complaining about taxes.
Yeah.
Right? It's like people don't empathize as much because
Yeah.
look at them, they're so successful.
Yeah.
Like, why they have a good family? Like, why would they feel alone?
Yeah.
Or it's that famous Hollywood actor that complains about the paparazzi and how they just want to live alone,
Mhm.
be with their families outside. It's like, why are you complaining? And why are you, like, we all have the right
Yeah.
to feel feelings that come.
Yes.
The world isn't fair. Sure, there are successful people, but that success doesn't mean happiness. Like, it
No.
doesn't, like, just because you've ran a marathon doesn't mean you're just suddenly the happiest person or you've got this great body. I've certainly met people way happier than me that have nothing.
Yeah.
And
Yeah.
I think I'd rather be that, not that I'd want to replace my lives, not that
Mhm.
I'm envious, and not that I want them to be less happy. It's just, I'd rather have more happiness than success,
I
Yeah.
completely relate to that. And I had that sometimes, like when my program has been super heavy, I've thought to myself, I really have to look after my mental health. School can come second. I really have to look after myself as a human being. And I feel like that's the greatest gift we can give to ourselves is just checking in on ourselves and making sure we're doing okay internally. Because if you aren't your best self, for yourself, how are you going to be your best self for those around you?
True. But yes, thank you so much for coming on the long-term podcast.
Yeah, thank you so much
Chloe.
for having me.
Yeah. Certainly with the chiropractor talk, I learned a lot. It's not my, I don't know much about it, but I did try my best to keep up.
I'm going to work on how I explain it too. So.
No, you did well. It's just, I understood a lot of it, but there are some where I was like, what's she talking about?
Yeah. I get that for sure. Yeah.
But you said layman terms.
Yeah, that's what we're encouraged to use. Basically, what layman terms or layperson terms is just using terminology, speaking to people who aren't familiar with the chiropractic profession, aren't familiar with treatments in words that they can explain or that they can understand. Like, for example, I'm not gonna say to you, like, I think you have like lumbar spinal stenosis between L3, L4, and we need to get you in for an MRI to make sure that that's the case. Like
wait, that's a spine. There's something in the spine, L, but then that's like the numbers.
Yeah, right. So just not using medical terminology, putting it into words that someone in front of you can understand who isn't familiar with chiropractic or, medical terminology in itself, because when you are using medical terminology with someone who isn't familiar with it, those words can be scary. You can be like, I don't know what that is. Like, is that bad? Like, do I need to go to the hospital?
Yeah, is this surgery? Like, am I gonna die tomorrow?
Yeah, am I gonna die? So yeah, it all really ties into communicating with your patient in a way that makes them feel comfortable and it helps them feel like they are part of the process. Like the chiro isn't just, the leader in the doctor-patient relationship. It's a back and forth thing. You're both contributing.
Yeah. Are there any last words to the listeners, viewers?
Goodness. Just don't let whatever you're struggling with in your life define you. If my life has taught me anything, everything I've accomplished, everything I want to continue to accomplish in my life, it's that your struggles do not have to define what you can accomplish in your life. They don't define who you are as a person. They can definitely mold the route you take in your life. And sometimes, you're not going to take the straight and narrow road. You're going to have to, do a windy road, move back and forth, change the road you're on. But if you are dedicated to achieving a goal in your life, you will get there.
Yeah. There's those constant pivots, but you'll get there. You
will get there eventually.
You won't get there unscathed. You'll be badly hurt.
Yes.
But that's part of the journey, and the people that are with you will help you, and surrounding yourself with people who love you and you love them back and you treat each other well. And sure, there are mistakes that are going to come, but you still understand each other.
Yeah. And just treating yourself well. I mean, don't just continue to push through that pain all the time. I mean, sometimes we're going to have to be resilient and we're going to have to keep pushing, but making sure you're checking in with yourself, asking yourself what you need to feel better, what you need to continue on that road.
Yeah, true. And thank you again.
Yes, thank you.
I appreciate you.
Awesome. Thank you.
And you have been very inspiring, and I'm going to take a lot out of this episode. I write notes sometimes to myself, and even listening as a third person, I still learn so much even as a listener, listening to my own content. So I have this rule of if I'm not going to listen to it, then why should I put it out to the world?
Yeah,
I need to be somewhat proud and be a fan of myself. You got to be your own biggest supporter.
No, that's great. And I'd have to say, the stories that you share on your podcast, the people that come on were really a big part of why I felt confident enough to be able to come out and, to discuss what I was struggling with, to just, remind myself there are people around me who are struggling with the same things and you would never know. So, just be your true authentic self, and, those who, want to accept you, those who want to be in your life will be in your life, and those who, don't, I mean, they're not going to be, but, they weren't meant to be in your life in the first place. So.
Of course, we all have someone that's right for us, because a friend to everyone is a friend to no one.
Yeah. Yes, that is very true.
Yeah. And as always, to everyone listening and watching, there is a place for you in this chaotic world. never lose hope, strengthen your faith, and keep it long term. Chloe Geraldes, everyone.
Awesome. Thank you.